whatever happened to those grocery cards? A lot of people out there have been contacting me during the live Q&As and in comments and saying, I just got my ANOC, the annual notice of change, and I've had a grocery card, those over-the-counter cards, grocery cards, you can pay transportation, some of those you can pay your rent or electricity or something. They've been very, very popular over the last few years. People always ask me, do they exist? Are they real? Is it a scam? They did exist. We'll talk about that. And sometimes they were scammy. A lot of those insurance companies and insurance agents out there, they would take the best card in the country that, is available in one area in southwestern Oregon or something. And then they would advertise it to the entire country. And then you'd call them up and they say, well, if you don't live in this part of the country, then you're not eligible for those benefits. But they did exist. They did exist. But a lot of people have gotten their annual notice of change and they said, Ed, what happened? I've had this card for a few years and it's given me an extra $200, $300. It's really made a big difference, but I just got my annual notice of change and it's gone, or they've reduced it by half. So we're going to get into that today. And this is also a live Q&A. So if this is your first time here, this is a live Q&A. If you have any questions on all things Social Security, Medicare, Medicaid, retirement benefits, disability benefits, any of the rest of it, make sure you leave your comment down there. Louise just says that she's on Medicare because of disabled. Do I qualify for the grocery allowance? I've been calling, people have been calling me daily to help me out, but once they hear my age, they just hang up. So, okay, so these are probably insurance agents and they found that you're on Medicare. And if they're calling you now, this is outside the annual enrollment period, which starts October 15th. So they're calling you now or up until now. And if you're not on Medicaid, you can't change. So they can't make money by switching you. So that's why they're hanging up on you. And then they find out your age. If you're on a Medicare supplement plan, like a G or an N, you can actually shop around any time of the year to see if you can find a better plan. But because of your age, in most states, you're not eligible for a Medicare supplement plan being on Medicare under the age of 65. So unfortunately, that's why they're hanging up on you. And well, the reason they're hanging up on you is because they're Marine Corps Sergeant here. They're assholes. So anyway, so there's that. But that's so-called the justification, and they're just nasty people. So there's that. Okay, so what is the deal with these cards here? Okay, so they had Medicare is trying to, make people healthier and all the rest of it. And they had this program that they started in 2017. It was called the Value-Based Insurance Design. And they said, hey, we've got a lot of people out there that are, receiving Medicare and they're not very healthy, maybe because they don't have quality food, healthy food. So we're going to try this project. So Medicare, these are tied to Medicare Advantage plans only. So we're going to try this project where Medicare Advantage plans, you can give your members some money to buy healthy food to make their lives easier. And hopefully that will make them healthier and everybody will save money because they won't, have to go to the hospital as much. They won't have to see the doctor or take any medications because they're getting healthier and healthier and healthy. So that was the idea. So Medicare Advantage companies and insurance brokers throughout the country ran with it, and they were giving out those grocery cards, $100, $200, $300. You could use it for transportation, food, all kinds of different things. And then Medicare ran the numbers and said, yeah, those, we're paying for those. Y'all are paying for those. We as American people, we pay through our Part B premium and our taxes and all the rest of it. But we tried that and we're looking at the numbers and people really aren't getting healthier, according to them running the numbers. So they said, okay, it doesn't look like it's a good program. We tried it. It's not working out the way we thought. We thought we'd save a lot of money, but actually we're spending a lot of money, giving these grocery cards out and people aren't getting healthier. So let's just go ahead and stop it. So that's what they're doing. The value-based insurance design, they are stopping at the end of the year. However, there is another program that's been around a lot longer. It's called the Special Supplemental Benefits for Chronically Ill, SSBCI. And those also have these grocery cards for healthy food. However, they are very, 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 very limited. Very limited. So this has been a program that's been around a lot longer since this newer one that's really come into fruition over the last 3 years. People over the last 3 years have, gotten these cards $200-300, and they've been very, very happy. And, it's really got them out of a pinch. But those are going away. And now the old system is going to be, still there. But there are 3 things you have to meet to get these new grocery cards. You have to have a chronic condition, a chronic illness, like diabetes or heart disease, and there's a bunch of other ones. But the best way is to contact Medicare Advantage plans and find out which particular chronic conditions, because it's not only if you have diabetes, that's a chronic condition, yes, but there's 2 other things that have to be met in order to get these grocery cards. You also have to be at risk of hospitalization or adverse effects because of that. Because you have diabetes, you have to be at high risk of being hospitalized or other really terrible adverse reactions. And you are requiring intensive care coordination. And so that's, bureaucratic ease for, your case, your doctors and, a specialist and everything, intensive care. And not intensive care as in going to the hospital and staying in intensive care, but your particular condition, it's like diabetes where it's under control and everything, then you probably wouldn't qualify. Again, these are kind of in the works, and each company I know is going to interpret it a little bit different, but super bureaucratic story short, there will be cards available. They're not going to be like they've been for the last 3 years or so. So if your card is already cut, and there's already people that I said that reached out to me and said, hey, they've already lost their card. It's already been cut by half or whatever the case may be. Make sure you put your add your comment into live or your comments into the description if you're watching this on a video later. But reach out to the Medicare Advantage plans in your area. If you're really desperately need for that extra $100, $50, it's going to be less than it has been. But remember, never, never, never choose a Medicare Advantage plan, because there's dozens in your area, and each company also has several plans. So people don't understand that. They say, well, I have a plan with company X and I'm happy with company X. Okay, perfect. Awesome. You understand company X has probably 4, 5, 6, 7 different plans in your area. And a lot of people say, I've had the same plan for years. Yeah, okay. Maybe that plan is slowly degraded over the years because they keep coming out with a new plan, that same exact company, to get new people, but you're on the old plan because you're, stubborn and you don't want to switch and stuff like that to the new plan that's going to save you a lot of money and get you more benefits. So not only check with the different companies in your area, but always focus on the most important thing, which is your health and your money in terms of, the costs of staying overnight in a hospital, the cost of a specialist. Just don't look at the zero premium. A lot of these Medicare Advantage plans are already zero premium. That's kind of how they trick you to get in there. I'm going to do a video tomorrow on how are they able to do a zero premium and still provide that. I'll talk about how Medicare Advantage plans get funded tomorrow. But focus on the most important things, that whatever plan you're looking at has your physicians. And let me show my little graphic here. So when you're looking for your plan, you look at the plan itself, your current plan, you look at the other plans in the area, you look at your providers. You want to you want to make sure if you have a doctor you really like and you want to keep that doctor, make sure your new plan covers that particular doctor or hospital, clinic. Your prescriptions are covered, the particular dosage of your prescription, the brand of your prescription. If you're, you got to have this brand versus generic, the price of those prescriptions. If you have a particular pharmacy that you just have to use, make sure that plan covers that pharmacy. And then your priorities. Do you need to save money on dental, vision? Do you want that, card? If there's a card available. And these Medicare Advantage companies are really going to have to document this. Supposedly, CMS is saying, okay, if you give out these cards to people, we want to make sure those three things are met, that, it's a care coordination type thing, the risk of hospitalization or adverse effects, or, and that they have a chronic condition. So those three things have to be met, and the Medicare Advantage plan has to document that in case they're ever reviewed by CMS, which, is anti-regulation now, so I don't know what's going on. So the priorities, and then patients. During the AEP, the annual enrollment period, don't sweat it if you can't switch your plan October 15th, October 16th, October 17th. You have until December 7th. So you have a bit of time. Don't wait until the last week, because that's when everything's going to get crazy. But around, just be patient. And your new plan won't be effective until January 1st anyway. And you can call our partners there at Chapter who sponsor our live Q&A and make sure all of this information is still free to you, including the website. So that's the situation with the cards. And let's see what type of questions. And Nancy says, my OTC, the over-the-counter benefit, really helps me with supplements my doctor has me on. So hopefully, Nancy, you're able to keep that. You've probably already received your annual notice of change, which lists if your current plan still has that grocery card for next year. And it's probably going to be less, because why am I saying that? Is because before this new trial program started, the old program was still there, and those were the benefits for those were always less. They're always a lot less in terms of dollar value. So if that same situation continues, then for most people, it's still going to be very, very low. Not as much as a lot of people were looking for. Louise, I would not trust phone calls. Yes, I know my insurance carrier is going to just give a grocery allowance to those with chronic illnesses who will have to discuss your health with someone. Yes. Yeah, those, they're not supposed to be calling you. Unless you call someone. If you call XYZ health insurance agent, Medicare agent or broker, preferred broker that deals with a lot of companies, they're not supposed to call you. If you have to reach out to them first. So if Nancy said, Ed, tell Chapter to give me a call, they wouldn't do it. I call Chapter and say, hey, give Nancy a call. They wouldn't do it, because you have to tell them to call you. So that's the way it should be. But unfortunately, a lot of people out there are not doing things the right way. Can a new administration cancel DOGE, the Department of Government Efficiency? Yeah, they can. All those people, particularly those people in Social Security that are there now, the DOGE people, yeah, they, were not put in there through regular processes. And so, yeah, they could tell them to definitely move on. But it's going to, in terms of Social Security, Social Security was already hurting before DOGE came in. They were at a 50-year low in terms of staffing. And staffing, those are the people that help people, file for retirement benefits and survivor benefits and make sure everything is correct. And it's been at a 50-year low. And then DOGE came in there, and now it's, it's the worst it's been since 1935. And so if a new administration came in there, or if the current administration decided, hey, we need human beings to answer the phones, we need people to process claims, so we're going to have to hire people. They could hire those people back. I'm not sure how many people would actually come back, but they'd have to hire new people. And it takes a good 2 years to train a Social Security employee. So if they decided, okay, we're going to hire 10,000 people next week so we can answer the phones and help people out and, get their claims approved on time, and Ed would be able to go back into retirement because I wouldn't need to be doing this because Social Security would be helping you. it would take 2 years. So I'd still have to do this for the next 2 years until those people went into class. There's a 3 months class, and there's the review. So it takes a good 2 years to learn the 20,000 pages of policy that Social Security has. So unfortunately, Social Security is going to be hurt for a long time. And unfortunately for y'all, I'm going to be here until the customer service goes to where it should be. I'm going to be here. So Walgreens don't take the cards in California, but CVS takes the cards, no problem. Yeah, they've those grocery cards. Sometimes they're a little temperamental. You know, you can't buy processed. It's kind of like food stamps type thing where you can't buy, you can't buy the rotisserie chicken because it's already cooked, but you can buy a whole chicken and cook it yourself type stuff. You can buy, Starbucks beans, but you can't buy, Starbucks. Felicia, I can't lose my food card. It helps pay for 2 of my bills. Yes, that is the situation that a lot of people are gonna be in. And remember, let me throw up my my website here, where if you click on the bottom there, living on Social Security alone, I've got a bunch of resources there. SSI, Supplemental Security Income, the welfare-based program, Social Security Ministers, SNAP, Medicare Savings Program. If you're low income, you're having a hard time, contact Medicaid in your state and apply for Medicaid, and maybe they will pay for your Part B premium, that $185, and that's called the Medicare Savings Program. And I've got a bunch of extra help with prescription drugs, food programs. A lot of these are taking a hit on the big, beautiful bill, the energy assistance, the big, beautiful for billionaires bill. It's, we had to put a couple $1 trillion into billionaires and, rich corporations' pockets. So we had to find the money someplace. So we decided to take it from the most vulnerable. So that's a beautiful thing, according to our politicians. So definitely check that out. And I'm coming up with a new program. It's getting close, getting very, very close, that we're going to help each other get through this. So can I have a resident address abroad and a P.O. box as a mailing address in the USA? How do I update my resident address with Social Security? Yep, yes, you can. In Social Security records on the MBR, the Master Beneficiary Record, which is the payment record, they have your mailing address and you have your residence address. So Social Security has 2 addresses. If you only give them one, then they just fill it out in both areas. But yeah, absolutely. You can have your residence address wherever you want, and then your mailing address wherever you want. So absolutely. So you can go online and change your address online, SSA.gov, My Social Security, set up a My Social Security account, or call the 800 number, or call your local Social Security office and they'll be able to change it for you. No problem whatsoever. If I make $15,000 a year, how much can I expect to receive from Social Security if I start taking it at 62? I'll have 24 years of work until that time. Yeah, it depends how you made Social Security. Calculate your benefits based on your high 35 years of earnings. So you make 15,000, then, if you made 15,000 over 30 years, so that's about $1,000 a month, your averaged earnings. So let's take absolute number. So let's say your average earnings is about $1,000 a month. Then we're looking at the bin points. The first one is 90%. So you're looking at about $900 a month. So, because that's how it's calculated. I did a video on the calculations of Social Security benefits yesterday. So, but yeah, about $900 a month. Remember, if you make under $967 from Social Security, you could also be eligible for SSI, which is the welfare-based program. And this year it's $967. So if you make $900 from Social Security and you've got really no other income or resources, you can apply for SSI if you're disabled or over 65 and get another $67. So, and then if you're eligible for SSI, you're also what's called categorically eligible for Medicaid. So you're eligible for Medicaid as well. So. Chip, what's up, Chip? Hopefully they choose to buy healthy food if they receive this benefit. A lot of people just love to eat junk food, myself included, for a long time. Yes, that's, I'm there with you. We got to cut back on that, don't we? Yeah. I set my little phone timer and I do a little stopwatch thing where I said, okay, I'm not going to eat sweets or something for 24 hours or 48 hours or something like that. So I try that every now and then, but so there's that. That's what I've been receiving, card for food, and you can also pay bills. I don't know about this year, what they may do for 2026. So Deborah, so it is September 26th. You should know what United Healthcare, they're supposed to send you what's called the annual notice of change. And it tells you, hey, Deborah, you've got this plan with us. And this plan with us for next year is going to be like this. And so you look in there, and you find out how much the premium is going to be. Usually they keep it at zero, but all the other stuff, that's where they get you, including, that grocery cart. You should already know. If not, you should know within the next 4 days. They're supposed to get that to you by September 30th. So find out what that is, and then you can shop around and see if there's another plan out there. But remember my 5 Ps. Let me throw that up again. Your plan, have your current plan available, and know your providers, prescriptions, pharmacy priorities, and just have a little bit of patience and, get it done. Doesn't matter who you call. If you don't call chapter, doesn't matter who you call. Have those things ready, because you don't want to sign up for a plan and then January, February comes along and you're so, oh, shoot, I forgot to focus on my provider and I really wanted that particular doctor, or I forgot to give that guy that helped me out, or the girl that helped me out, my prescription. And now I forgot to check that prescription. So I don't care who you call, but make sure you're prepared. So the 6 Ps, very, very important. Let's see. On your website, is there a place to tell us the maximum amount of Social Security limit that will be taxed? I'm located in the state of California. I'll have a friend in New York City asking as well. In terms of taxation, the max limit is 85%. So it's not, they're not going to tax 85%, but 85% of your Social Security benefits are taxable at whatever rate you pay. So if you pay, 10%, then 85, you'll pay 10% on that 85. And yes, there is on my website. I don't like giving tax type advice because I'm not a tax type person. But let me see here on the retirement, you click on the little retirement thing and it has the little tax. Oh, I've got to show the screen, don't I? So it's mygovexpert.com. And you click on the retirement there and you click on the tab that says taxation, and then it gives you that right there for 2025. So, and then this little button here, you can calculate your taxable benefits on the IRS website. Let me check to make sure this link still works. Sometimes it's okay. Yep, it still works. I make it a little bit, okay. And it says right there, on my Social Security Railroad retirement benefits taxable. And then you just click on the little thing and you begin. So it takes about 9 minutes to do the little thingy there. And it'll tell you how much is taxable and all that. So, but if you're paranoid about clicking on buttons on other people's, websites, which is a very, very good fear to have, just Google IRS, are my Social Security benefits taxable? And it'll take you to this particular little tool here, this little calculator. So, Keep Smiling. What's up, Keep Smiling? I'm still confused about doctors and their contracts with Advantage plans. Are all doctors' contracts up at the same month, or et cetera? No, a doctor can, if you have a Medicare Advantage plan, you essentially sign a contract for a year. You're going to have that Medicare Advantage plan till the end of the year, unless you move or something, or you get Medicaid, and you can switch plans. There's certain things you can switch plans on, but for the most part, you're on it for a year till December 31st. And then if they automatically renew it, then you continue that plan unless you're smart and review your plan. But doctors can drop out anytime. So I've had people that, did the 6 Ps and they checked their providers in October, November, and they said, okay, I got to have Laura Smith, Dr. Laura Smith. She is awesome. I got to keep her. The agent, whoever checks or you check, and yep, Laura, Dr. Smith is in this plan. Perfect. I'm good. And then January comes around, you go to the office and they're no longer in the plan because they Dr. Laura says, I don't like that company anymore. I'm not going to do business with them anymore. So it's unfortunate. That's why, people get those Medicare supplement plan, like a plan N or plan G, where you don't have to worry about that. If the doctor takes Medicare, then they take your plan. So there are no networks or anything. I always say, if you have a Medicare supplement plan, your network is America. So I have an appointment with chapter, sent review page and phone number to my ex-husband. Thanks. Awesome. Wow. Looking out after your ex-husband. You are too awesome like that. Yeah, it's good to be civil nowadays, right? I like it. And please, any company I recommend, I watch them like a hawk. And Chapter has been doing a phenomenal job, really helping people out, doing the right thing. But if they don't, please let me know. Please let me know. And again, the patients thing, if you call Chapter on October 15th, yeah, if you get in, I would head down and get to the lottery as well, because it's going to be crazy. There's 1 million people losing their PPO plans this year. And so it's going to be crazy. But again, you have until December 7th. So we'll make sure they help you out before December 7th. So I only have Medicare A and full insurance through my job. Yep. Smart idea. Absolutely. Smart idea. So if you have health insurance from work, why waste money on Part B when you don't need it? And the reason you got Part A is because you're smart and hey, it's zero premium. And my health insurance from work has a high deductible. If I go into the hospital, the Part A deductible is cheaper. So I might save some money there if I ever go to the hospital. So Nana Donna, tell all those Medicare people who call me that they're calling me illegally because I did not ask them to. Usually they hang up. Yes. And you can tell them, the way to do it is you say, oh yeah, I'm very interested. And you talk to them a little bit and get their name and their company. And then you call, Medicare, or you call one of the company that they recommend and say, hey, I didn't tell this person to call me. They're not supposed to be calling you. And when you walk into a Walmart or a Target and they've got that little booth there, little table that says, ask me about Medicare, they're not supposed to approach you. That's why they have that sign that says, ask me about Medicare, because they can't talk to you until you ask them about Medicare. So it's very, 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 very regulated. But unfortunately, the same people that call you are not supposed to be calling you, or are suspicious from day one, from second one. So if they're doing things wrong like that, then I wouldn't trust them to do anything else, because they're not supposed to be doing that. I have calls that offer a plastic Social Security card. I told the last one, if Social Security wanted me to have a plastic card, they would send it. Yes, Social Security doesn't do plastic cards. Yeah. That's another scam. And then they do the plastic Medicare card too. That's another scam out there. And so they want all your information. You're like, yeah, I was born at night, but not last night, right? There was a little interesting Social Security history there. There was many decades ago a wallet company that was producing a wallet, and they wanted to show people that a Social Security card could fit on the wallet. So they made a mock Social Security card, and the owner of the company used the Social Security number of his secretary. And so they produced these wallets, hundreds and hundreds of thousands of them, and sent them to places like Woolworth and stuff, and people bought them. And then they eventually thought that was their Social Security number. So there was about 40,000 people walking around in the United States with the same Social Security number of that secretary. So yeah, that was a nightmare. So I'm worried. I haven't seen Bella yet. Anyone know? Oh, was Bella not? No, Bella's here. Bella's here. Yeah. Yep, she's here. So yeah, do we got the greatest community online here as people looking out for each other? So you guys are awesome. I got a call yesterday and told them I took a screenshot, sending it to OIG. Oh, okay, good. Office of the Inspector General. Good. Yes. Anything like that, You're talking about Doge. In terms of Social Security, Doge was a complete failure. They said, oh, they're going to find, billions of dollars of fraud, waste, and abuse. They didn't find anything. The whole thing about, 200-year-old people receiving Social Security benefits, they just didn't know what they were looking at. So they didn't find anything. You know who finds fraud, waste, and abuse in Social Security and Medicare? Y'all do. So if you get a bill from your doctor, a hospital, a health insurance company, and sometimes they do these upcoding where they said, okay, we gave this person a Band-Aid. We're going to charge them $80 for a Band-Aid. And then they upcode it to a tourniquet, you know, and we're going to charge you $10,000 for a tourniquet. And so when you get your bill, you know, just, you know, if you got a few seconds, just don't look at, you know, they send those bills and it says you don't owe anything. Most people stop there and they throw it away. Take a few more minutes and say, okay, yep, I did that. Yep, I did that. No, I have no idea where this is. So, so you might be adding to a case of that particular doctor or that particular hospital that's been doing that. So that's another case that the authorities can use to prosecute those people. So y'all are duly deputized, yes, like like Eddie Murphy in 48 Hours. I sent her a message, no reply. I was getting concerned. She's always, okay, yeah, she's here. I lost my straight Medicaid and now have a plan first spin down type Medicaid, which caused me to be unqualified for my D-SNP Medicare Advantage plan, which caused me to lose my OT. Is that a nightmare? And, so you lost all of the extra benefits, you know, the cost sharing and, you know, they covered your co-insurance and your co-payments and all that stuff because you lost your dual special needs plan, your dual plan. And because you lost that, you also lost that over-the-counter grocery card. And because you lost the D-SNP, you're also going to have to start paying that $185, the Medicare Part B premium yourself, because they're, yeah. So if you disagree, if you say, no, I should have Medicaid, I should have the full Medicaid and everything, then you need to, you know, fight it. Please fight it. And or if situation changes. If you say, oh yeah, when they reviewed it, I had some money that, you know, was left to me or something, and yes, I had it, so therefore I wasn't qualified for a month or 2 months or something like that. But since then, I've spent that money down, and I don't have that money, or I spent it to, you know, fix my car or house, whatever the case may be. Then yeah, make sure you fight it. So, hoorah! Air Force retired. Fourth try, final whip. Why has Social Security not received info on my self-employment income for many years? I have had my business and paid taxes. Social Security said they get what the IRS sends them. Yeah, you, did you actually have a profit? So did you actually pay Social Security taxes? So the IRS, you did your thing with the IRS, but if nothing from that results in you paying FICA taxes, then Social Security doesn't get it, you know, notified. IRS says, yep, this person self-employed, they did the self-employment, you know, tax returns, and but they didn't have any net income from that business, and therefore they didn't have to pay taxes on that. And so we don't have to tell Social Security anything because they didn't make enough money to pay taxes, FICA taxes, the Social Security taxes. So that's usually the situation. For those people out there that have a business, husband and wife, be careful. Tax people know the IRS, but they don't know Social Security. So if you're a business, husband and wife business, and you file taxes, quite often what happens is the tax person, your tax preparation person, they just put all of the, you know, net income under one Social Security number. And, you know, if that's how you want to do it, then that's how you do it. But it goes on a one Social Security number. So I've had this many, many times. People get divorced later, and then the other spouse goes in to collect Social Security, and they're like, no, you didn't pay Social Security. No, wait a second, our business made $200,000 a year. Yeah, but all that went to the other spouse. You've got zero. So make sure, you know, if you're going to stay together forever, then yeah, I guess it's not a big deal. But yeah, anyway, I'm not going to comment on that. Thanks, Dims. I was to get free medical for life when I retired from the military, but Bill Clinton changed that. Not sure. Yeah, if you get TRICARE for life, you get TRICARE for life. So I'm not sure what Bill Clinton had to do that. They sent the information by email. Check and see if you have bypassed it. Oh, okay. I was wondering about that. The ANOC you're talking about, they're supposed to send it by snail mail. So yeah, that's the first. You're the first one I've heard that got it by email, but they're supposed to. Maybe they send it by email and mail. But anyway, anyone see the food cards on YouTube for 15 or 3,500? I assume these are scams. Yeah, what they do is they take the yearly thing. So they say, hey, it's $100. So here's a $1,200 food card. It's over a year or something. But yeah, not 1,500 or 3,500. At least not for Medicare Advantage. So yeah. Does your website talk about the return to work program? Absolutely. It does and does and does and does and goes on forever about that because it is a difficult thing. So let me pop it up there. So disability, click on disability there and then click on working and benefits. And then I've got two things. I've got a little calculator there, it's SSDI. It tells you a bunch of questions. And then I've also got a free. Everything on the website is free because, again, Chapter and different places support our work here. So it tells you about the extended period of eligibility, trial, work period, and all that. So, yep, absolutely. Let's see here. Does the administration make you work 20 hours a week for food card? And is that like food stamp? Yeah, no. Good question, though. The food card is not food stamps. So food stamps is completely different. That's SNAP, what they used to call food stamps. But yes, starting in a couple of years, they're going to make people that are not excluded. That is, if you're disabled, you're over the age 65, you're pregnant, you've got young children at home or things. If you're not in those particular categories, then yes, you'll have to put 20 hours a week, so 80 hours a month, either volunteering or working. And so states, that is for Medicaid and food stamps. So the states are figuring that out now. And that's going to be, every state that's tried that has learned that it costs more than it actually saves. So, but a lot of people are going to be kicked off because of this bureaucratic nightmare. I call it bureaucratic disenrollment, where like at the end of the pandemic, there were a lot of people that were eligible for Medicaid. They were 100% eligible for Medicaid. But because of the nightmare, the bureaucratic BS and the offices, the welfare offices, the places that process those Medicaid claims, they dropped the ball, or they're understaffed. All those things are barriers, walls to people getting what they're eligible for. And we saw about 65% of the people that were actually eligible lost their Medicaid, either permanently or temporarily. And that could be, life-threatening. So we're going to see, and so that's why our community is coming up with a solution for that. So if you know anybody on Medicaid, you want to help people out on Medicaid and food stamps and Medicare and everything, then make sure you stay tuned. Subscribe, like, share, all that kind of good stuff. So, Linda, I'm 80 years old, disabled, widowed, DDD, disc disease, chronic. Can I get help with paying the $185 on Medicare plan? Absolutely. You can definitely apply. That is through Medicaid. So you apply through your state's Medicaid office, whatever they call Medicaid in your state, but it's all Medicaid. Apply there. And if you're approved for the higher levels of Medicaid, then they will pay for your $185 Part B premium. And you'll get other cost savings as well. So definitely apply. The only other way to get that $185 paid for or partially paid for is through what's called a Medicare Advantage Part B give back. And we don't have, we'll have next week the plans for 2026. And I'm going to have Ari from Chapter on the program October 1st. And he's going to give you some trends of what's going on for 2026 and answer any questions about all that. So I've got a couple of questions here, video questions. So let's go ahead and answer those two questions real quick.
Dr. Ed, I'm 65 years old on disability. I want to try to see if I can earn more money. Um, I tried to contact Social Security to tell them I want to go do some gig work, maybe drive as much as I can, but I don't get no answers. And my family is in dire need for some help. My Social Security is not enough, and my wife's job is not enough for the household. So I'm trying to make extra money. I don't know how to contact them. It's the most difficult thing I ever done.
Okay. As soon as I saw him, I almost had a flashback. He looked exactly like one of my old master sergeants in the Marine Corps. So yeah, and I'm like, oh my gosh, Top, what are you doing there? So anyway, all right. So let me show you. I just popped it up here. So yes, if you're receiving disability benefits, Social Security disability insurance, absolutely, you're allowed to work. Social Security, Congress has decided they want you to try to go back to work because everybody wants you off disability. If you're able to get off disability and go make some money, and you're happy you're making some more money, getting out of the house, being productive, whatever the case may be, and it helps tax the Social Security trust fund. So everybody wants people to go back to work. If you're able to do it, Social Security tries everything to, well, they're supposed to try everything to help you go back to work. So as I just showed the working and benefits there, that one. But the important thing for you right now is the trial work period. So for 2025, well, forever, if you're on disability for the first 9 months, you can work and make $1 billion a month. It doesn't affect your Social Security benefits. It's called a trial work period. So Social Security wants you to try to go back to work. For 9 months, they don't penalize you at all. You go back to work, and if you're able to make $1,000, $2,000, $3,000, $4,000, then if you're able to continue that after 9 months, then you say, okay, well, I guess I'm able to work. And then you cancel Social Security. Depends on how much you make. But for the first 9 months, you're good. Go for it. Go out there and do what you can. Don't obviously, push yourself too much where it, makes you even less healthy, because nobody's going to benefit from that. But you go out there, and there's called a trigger month for trial work period. So if you go out there in the gig economy and make under $1,160, then you can do that forever. But for 2025, the month you go over $1,160, that triggers one of those trial work periods. So if you go out in October and make $1,200, then October is the first of 9 months. And then you have 8 more months, and they're not necessarily consecutive. So you can work a month, make over, that amount, take a month off, and then work another month. So trial work period, 9 months, not necessarily consecutive. And then after that, after the 9 months, then there's other SGA, EP, but just check out my guide there. But yeah, go for it. Go for it. So yes, most of my bills don't show itemization. Yeah, I agree. But you can definitely ask them. Say, hey, what's going on here? I just want to confirm that, y'all are doing the right thing, and they should be able to send you details. I'm in the same situation as Dari and in stress mode. My benefit increased, divorced spouse, but I will behind the 8 ball with out of pocket. Yeah, if that's the case, then you definitely need to, check in October when the new plans come out and see if you can save anything else there. And then look for all the other programs. Make sure you're part of that extra help with prescription drugs, help you out with that. Apply for Medicaid, energy assistance and all that. So we're coming up with a program to help everybody on that, to help each other on all that. How can I get a grocery card on SSDI before it ends? Yeah. So once this video is done, then it automatically goes into the regular videos. So you just go onto my tube view. Since I'm broadcasting on others, I want to be careful. And then you click on the live section in this video. All my videos, all my 1,000 or so videos will show up there. So Kim, if I get back pay from SSDI, will I be ineligible for any help until it's gone? So in terms of if we're talking about the grocery cards, then it really depends on your state. Because those grocery cards are really going to be tied to a lot of them Medicaid, chronic illnesses. So if you get a lot of money, and then you're probably, depend on your state, you're probably not going to be eligible for Medicaid. Unless, if you get that back pay and then you're like, oh, okay, I've been waiting for 2 years to get my SSDI, and I've borrowed a lot of money. I've put off a lot of things, getting the house fixed, getting the car fixed and stuff like that. So you get that money in and then you spend it on things that you needed to spend it on. And then that's called kind of a spend down. And then you would be able to get whatever you're eligible for. So yes, but I would reach out to all those different sources and apply for Medicaid and stuff. And just, if they disapprove you, if they deny you for whatever reason, just say, okay, why? And they'll say, oh, because you got that money. And it says, oh, okay, well, I've got my car. It's going to be in the shop next week. And so all that money is going to be gone. When should I reapply? And they'll say, oh, okay, yeah, when you no longer have that, $20,000 in the bank, then yeah, come on back. So, all right, let's see. Keep smiling. Still no ANOC yet. Even without that, you can, so if you don't get it for whatever reason, it's lost in the mail or the company fails to send it, then the new plans will be available October 1st. You can switch starting October 15th. So you can reach out to the person that helped you sign up or someone or reach out to chapter. And even without the annual notice of change, the Medicare insurance agents and brokers will be able to see your plan and kind of explain it in English. I was offered ANOC by download from Cigna. Oh, okay. So another one. So it sounds like these companies, I think that's a good thing, that they give that option. They say, hey, if you want paper, we'll give you paper. If you want to do it email, you can do it email. So yeah, I think that's fine. Thank you. I'm heading to your website right after you're done with the live chat. Okay, yes, it's a free website. The only thing we do charge is I have a retired Social Security employee. My Jackson is her name, and she does one-on-one calls. So if you're interested, so you can click there and schedule an appointment with her and talk to her one-on-one, and she has appointments available there. But that's the only thing. Yeah, she charges for that, and that keeps up the website monthly charge. But everything else is 100% free. So go for it. Let's see here. Part C. Yeah, Part C is Medicare Advantage. I hate calling it Part C because it makes it sound like it's part of original Medicare, and it's not. It's a private company's. But anyway, there it is. All right, let's get one more question here.
Hi, my name is Sue. I live in South Dakota. I'm on disability. I'm 62. I've been married to my ex-husband for 30-something years. And my first husband, unfortunately, passed away in 1987. I'm wondering, which one do I file on? Divorce or survivors?
Okay, easy answer. Wherever you get the most money. So since you're divorced, you can go on either one. So when you file, you have to file for, if you're looking for spouse benefits, divorce spouse benefits, then you have to file for benefits on your own record, and then you file for the divorce spouse benefit or spouse benefit. Your benefit amount has to be less than half of theirs. But when you go to Social Security and say, hey, I want to file for, benefits, either benefits on my own record and spouse benefits or surviving spouse benefits. And you just tell them if you got the Social Security number of your two exes, just give them that. If not, just tell them the name, how old they are, the date of birth, where they were born, and they'll be able to find the Social Security numbers, and they'll look at the record and they'll tell you where's the most money. So if it's your deceased husband, then You can file for benefits on that person's record as early as 60 years old and not touch your own and let yours continue to increase. And then one day you switch over to yours. So which one? Wherever you're going to get the most money. So we moved to Florida 4 years ago. Husband applied for driver's license. They asked if he was 6'5" Haitian who owed child support. They said they used his social security number and owed child support. What to be done? Yeah, so you just you contact them and you say, no, that's nothing to do with me. So that has nothing to do with Social Security. It's an unfortunate part of everybody using the Social Security number as your universal American number, which should never have been used. Social Security number should have always been for Social Security. They shouldn't have used it on driver's licenses, on credit reports, on home loans. They should have picked out another number. But yeah. People used to come into the office, they still do, but I'm not there anymore. But people go into the Social Security office all the time and said, hey, somebody's using my Social Security card. Oh, okay. Are they working under your Social Security card and paying Social Security FICA tax on your Social Security card? Oh, no, somebody just bought a boat. And they say, well, yeah, sorry, can't help you. So that has nothing to do with Social Security, unfortunately. The only thing it has to do with Social Security is if someone is working under your Social Security number and paying FICA tax under your Social Security number. And you're like, oh, I'd love that. Yeah, until they catch that person. And then if your monthly benefit amount increased because someone was working under your Social Security number, you're like, hey, I'm making an extra $100 a month because someone was using my Social Security number. Okay, all right, enjoy it. Because eventually they'll catch that person a year, 2 years, 3 years down the line, and then they'll say, hey, you should have told us that. We want all that money back. So you have to return, 3 years of $100. So, yeah, don't do it. They always get caught. So is it true that it's easier to qualify for disability as an older adult? I'm 59. Yes, because they determine, your ability to work. Social Security defines disability as the inability to work. So if you're younger, 20s, 30s, 40s, and you have a high education, and then you've got a lot of possibilities. If you're older and, experience is not very much, and education, then you're lower ability to go out there and find work. So yes, they do take that into account. So random life things. I find that the U.S. has so many clauses, policies, et cetera, that it confuses its citizens. Wish they'd simplify things for the common man on the street. Yes, I agree. But in terms of Social Security policy, I agree with you 100%. It's over 20,000 pages of policy. But if you look at each one of the little things, it's, like the disability, receiving disability and being able to work. Yes, it's a nightmare. But each one of those little steps kind of makes sense. Yeah. So if you think about it, and that's the problem, people don't want to think about it. And that's why you need people at the Social Security Administration that know that policy, that have been trained in that policy and pick up the phones and help you navigate. That's their job, is to help you navigate the bureaucracy to make sure you get everything you're eligible for. But politicians refuse to provide that service, even though you paid for that service. All those decades you paid into FICA, you paid for that customer service. But politicians are refusing to give you that customer service. And therefore, people are losing money every single day. Our community here has probably found billions of dollars for people over their lifetime. Oh, I didn't know I was independently entitled divorce spouse. Oh, I didn't know I was entitled to RIB-DIB. I didn't know I was entitled to surviving spouse benefits. I didn't know I was entitled before I was 60. I didn't know I was entitled to disabled widows benefits. I didn't know I didn't have to sign up for part every single day. So that's why we have the best community on social media. Social Security has me disabled, but I'm not on Medicaid anymore since I'm on FRA. Yep, that's fine. Yeah, you're still disabled if you're disabled, but the Social Security benefit, they just switch you to retirement benefits. So for Social Security, yeah, you're still disabled, but you're not receiving money out of the Social Security Disability Trust Fund, and you don't have to do the CDRs, the continuing disability reviews, and you're not limited to so just a bureaucratic thing for Social Security. You're still technically disabled, but you're just not receiving a disability benefit payment. So, yeah, and Medicaid is. Yeah. Someone did a video yesterday. Says, yeah, I just turned my full retirement age, and Social Security says I'm not disabled anymore. So they cured my disability, or something like that. I forget how he put it, but yeah, that was yes. I was on trial to work. I earned $7,000, but Social Security stated that I was overpaid. What can I do? Fight it. Fight it. Absolutely. If you disagree with the way they set up the overpayment and you believe you weren't overpaid at all because you stayed under, you were under the trial work period or the extended period of eligibility, whatever the case may be, fight it. So if you go onto my website and click on overpayments there, it tells you how to do it. So if they send you an overpayment, you can pay it in full. You can request a waiver, appeal the decision, request a lower benefit amount. But the first step is the request a reconsideration, SSA 561. And you put down there that, hey, no, you got it wrong. One of the things that happens is Social Security can actually average. So if you kind of work in, the gig economy where your kind of income goes up and down and stuff, Social Security can, and sometimes they can average that. And they say, okay, in this month and this month, you made way too much, but these other months you didn't. So they can average it over the year. So that's another thing that, unfortunately, that has to be done manually. And that's why Social Security needs staff. So fight it, please fight it. If you already have Plan C with Medicare and partial Medicaid, I'll be fine. Yeah, so Plan C is the Medicare Advantage, and if you have Medicare, and partial Medicaid. So good. Thank you for that. People think Medicaid is Medicaid. No, there's different levels of Medicaid. There's QMB, Qualified Medicare Beneficiary. There's SlimB and QI, and there's different categories of Medicaid. So if you have the higher levels of Medicaid, then those are the ones that pay for your Part B premium, that $185. But if you have kind of partial Medicaid, one of the lower parts, then yeah, they don't pay for the $185. But remember, Caven My 2, you have that partial Medicaid there probably because you've got your Social Security benefit is a higher amount, or you've got some other income or resources or something, or you live in a really cheap state like Texas or Alabama or someplace. But if your income resources ever changes, then, contact your Medicaid office and say, hey, up me, right? Give me the higher levels. So, Chapter texted me today to see if I want to go over my plan. I didn't call yet, so I made an appointment to go over everything. Okay, perfect. So that means you contacted them before. And they're following up. So great. Perfect. So, and again, we'll have Ari here October 1st to go over some of the details. So are we allowed to recommend another YouTube on this chat? Yeah, I don't mind. As long as it's, there's a lot of YouTubers out there that are giving Social Security advice that I wish they would stop. If I contact some of them sometimes and I say, hey, what you said here was incorrect. And most of the times they fix it. So it's, yeah. But how many people saw that and made a life decision based on incorrect information before I was able to catch it? So. Susan, I get extra help. They pay my premiums because of low income from Social Security. I have regular Medicare. Am I supposed to change? I have no other insurance and just broke my knee too. Oh my gosh. So you got the extra help. They pay your premiums because of low income from Social Security. Okay, so they pay for your Part B. So if they pay for your Part B, that means you have the higher level of Medicaid. So you have Medicaid. I'm hoping this is correct. So you have Medicaid, Medicare, which you can have both. There's millions of people that have both. You also have the extra help with prescription drugs. Awesome. Hopefully they're paying for your Medicare Part B. That's the Medicare Savings Program. So it sounds, and then you can get a Medicare Advantage plan. And, I have been saying maybe if you've got the higher levels of Medicaid and you get a grocery card, but those are going to be highly limited next year. But always, try to get everything you can. I'm going to talk about how Medicare Advantage plans are financed tomorrow, and maybe give you some inside scoop, and that way what you need to fight for. So, Rick, as soon as I get some of my financial issues taken care of, I will be sending you and your son a check to CPC, keep you guys in coffee or whatever. Oh, you're too awesome. I appreciate that. Yeah. Hey, it's a thought that counts. A lot of people out there. And that's what's, the chapter and our friends over at DIG who does let me move this here. The final expense burial insurance. So any company like that, they throw us a few bucks and that puts up the website and the new website, which is costing tons of money, but thanks to chapter and you guys, it's trickle down economics. So trickle down economics does actually work. It's just that these big health insurance companies don't know they're doing good. So don't tell them. So you sign up through chapter for whatever, plan is best for you. The company pays chapter throws us a few bucks, and then we put that into our free information. So our free platform and our free websites and everything. So the trickle down is from these big health insurance companies. It's actually trickling down to get you all more help. But like I always say, don't tell the big insurance companies they're doing good because they might cut us off. It's like, I think that's against their corporate charter is to do good. So anyway. All right. That is it for today. We are over time. I'll be back again tomorrow. And tomorrow I'm going to talk about Medicare Advantage financing and why that's super, super important for you. It sounds like it's going to be super, super boring. But I think once you understand how it works, you'll fight for more of what you paid into. So, all right, y'all take care. Have a beautiful night. And please, 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 please take care of each other. Bye-bye.